Here we're going to talk about why it is important to do an endoscopic brow lift in junction with a blepharoplasty. Well, many times when we're doing the exam for a blepharoplasty, for our upper blepharoplasty, and we have a look at the eyebrow, we can discover that the eyebrow is lower than the supraorbital rim, that is this bone that is above our eyeball. When this is a fact in my patient, I have to consider that only doing a blepharoplasty is not the right way to go. It is very important to reposition the eyebrow above this orbital rim or this bone, so that when I'm doing the blepharoplasty and I'm taking away the excess skin, I don't end up pulling this eyebrow lower or to a lower position. Because by doing that, I will not end up with a less tired look, but that's what we want. That's why my patient is having an upper blepharoplasty. So it is very important to always examine the eyebrow with respect to the excess skin on the upper eyelid to see who is a good candidate to do blepharoplasty alone or do blepharoplasty and endoscopic brow lift. How do we do an endoscopic brow lift? Well, we do little incisions that are in this area in the scalp, here, 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 and here. And we will introduce a small camera that will go all the way down to this bone or to this orbital rim, because we need to detach all of this skin and attachments so that the eyebrows really can be pulled up. Sometimes we can find out that maybe putting just a small stitch and pulling will be enough for really repositioning the eyebrow. And this is not correct, because if we only do just one stitch and that's all, well, guess what? The eyebrow will go down very easy again. So this is why we have to go all through this, detaching everything of the skin on our forehead and down to orbital ring, so that we can really pull and that this pull lasts in time. So make sure, if you're considering having an upper blepharoplasty, that you make sure and see how your eyebrow is. That way, you will end up with the correct surgical plan for you. And remember, if you have any questions, please don't doubt in contacting us at www.drlinatriana.com or social media that you'll find here.